Welcome back, my name's Lindsay and this is all things aesthetics. So today's video is going to be it's going to be for everyone basically. It's going to be for practitioners and it's going to be for clients as well. So we're going to be doing a little video today on the differences between bruising, swelling. We're going to be covering lumps and bumps, the difference between a hematoma and a bruise, and the signs and symptoms of something more serious such as a vascular occlusion. So if that's for you, keep watching and we will get straight into it. So we will start off with bruising. So bruising is very, very common with injectables. It's extremely normal. Anyone who says they don't get bruising when they get injectables is very lucky, or they're lying. So yeah, I think it just depends on you as a person, really, whether you bruise or not. Bruising, as I said, it's very, very common. Same as if you went and got a blood test done in the doctors, every single time I get a blood test done, my arm goes green for ages. So yeah, bruising is very, very common. I will pop pictures up here just to show you guys some examples of bruising, what's normal, so you can have a little look. Little bits here and there is normal. Again, if you get a patch that's gone dark, that's normal. So yeah, again, bruising, very, very common. We'll go into the difference between what a bruise is and what a hematoma is. But I just want to clarify that a hematoma is a bruise. Not a lot of people know this, but a hematoma is a bruise. It's just a very, quite a big pool of blood under the skin that's not really managed to, what's the word? It's basically, a bruise is where you've injected and, you hit a vessel and it just bleeds out a little bit and you just, the blood's just come out a little bit and it's just left a little area. A hematoma is where you've hit it or hit something that's larger, a vessel, and it's just bled out a lot more and it's just leaked and it's just, gathered into a pool of, blood underneath the skin. They're the same thing. It just, one looks a little bit worse than the other, but essentially they are just both bruises. So again, I'll put a picture up of what like your typical hematoma looks like. But again, same as bruising, it's nothing to worry about. It's very, very normal. Hematomas are a lot less common than bruises, but yeah, still completely normal. Another thing that is quite common with injectables, especially in the lips, I would say, is lumps and bumps. Especially a couple of weeks up to a month after the treatment, you're bound to get some sort of lumpy bumpiness around the area. 9 times out of 10, it's just a bit of swelling or bruising under the skin, or where the filler's just, settling on its own. You've had a lot of trauma to the area, so it's not going to be completely smooth like the whole way through their healing. You are going to get a little bit of lumpy bumpiness. So a little bit of unevenness and swelling here and there is completely normal while they're healing, around 2 weeks-ish, I'd say, maybe up to 3 weeks. However, if during, I'd say anything around 2 to 3 weeks, after that period, if you feel in your lips that you've got hard, solid, like frozen like peas, frozen pea-like balls, like where you're like with your lips and you can feel it's like solid balls, then that's not right. That's obviously where the filler's gathered together. Or it could be a cyst under the skin. They're the main things that cause the lumps and bumps. So in that instance, go back to the practitioner, ask them, what you can do to resolve it. Sometimes your practitioner might just say, apply a hot compress, give it a little massage. And not massage, we don't mean like, oh, lovely, that's nice. We mean get your fingers where the ball is and squash it down hard until it's flat. If you can't do it or it doesn't work, then your practitioner should be able to do it for you. If we're not able to, what's the word? Not salvage, if we're, oh my God, what is the word? If we can't resolve it or get rid of the lump, basically, your practitioner will just go in and dissolve it. And you can just dissolve that little lump. So yeah, it's quite easily done. So again, very, very common. So let's talk about migration. Migration can happen for so many reasons. So it could either be, one, your body just doesn't like it, and rather than breaking it down and flushing it through your system, your body's pushing it away. So where it was in your lips, your body after a while is just trying to get rid of it, and it's just pushing and it ends up just around here. So that's one reason. Second reason is product choice. Everyone knows that I literally hate Juvederm. Everyone calls it Movederm, and I don't even need to explain why. Movederm literally moves everywhere. You put it in, it might look nice for 2 weeks, and it moves, it loses its shape, it's all puffy, and yeah, not nice at all. Sorry, just not my favourite product. My least favourite product. Migration could also happen because of placement. So if your injector's injected outside of the lip line, or outside of the border or near on, that can open up tissue space and it can cause damage, and the filler can travel. Loads of things. Smoking, they say, can cause migration. Overfilled lips causes migration. Just loads and loads of reasons. But migration, again, I'll put a picture up here so you can see. Migration happens when the filler just travels all outside the border, or it's just not in the lip line anymore. Or you can get migration where when you turn your lips up and it's all in the waterline underneath, that can be migration as well. So let's talk about vascular occlusion. So there's loads and loads and loads and loads of things that, vascular occlusion shows like. For me, when I had a vascular occlusion on me, I'd only been trained for about a week or two, I think, and I had my lips done, and unfortunately I did have a VO. For me, there wasn't any significant pain because I was numb from the lip filler. It had lidocaine in it, so that's, sometimes you can feel sharp pain, sometimes you don't because you're numb. For me, the first thing that I noticed was I was driving home in the car and it was late at night, and I could feel my lip was cold. Even though I was numb, it just felt really cold, especially on my tongue when I was going like this. It just felt ice cold, and I kept looking in the wing mirror and I could see it was a little bit white, but obviously where it was dark I couldn't really see. And it was only when I come home and I saw that it was pure white. I will post a picture here of my VO. Sorry, it was from literally 5 years ago, so it's really bad quality. But you can see the area was really, really white, and you can see it's like a whole patch of my lip that's gone. I did apply a hot compress and try and massage it out, but it wouldn't go, so I did end up dissolving it. You've got other symptoms of vascular occlusion, mottling in the skin, rashes, pustules in the nose or along the nasal folds is, more common here if you get a VO. Coldness, tingling, numbness, rashes, pustules. There's no blood flow, so the white area. So when we say capillary refill check, we mean to press down on the area for 10 seconds really, really hard. And then when you let go, the blood flow should come back. I mean, I've got really bad blood flow on my hands, so I'm not even going to bother doing it. But yeah, you would press down on your lip for 10 seconds really, really hard. And then when you let go quick like that, you should see the blood flow come back within about 2 to 3 seconds max. If it doesn't, or it's very, very slow, then that means you've either got a vascular occlusion where it's completely blocked, or you've got a compromise. So they both show exactly the same. It just means one's a little bit compressed and one's actually blocked from the inside. That's it. So if that is the case, you just go through the procedures of your heat, hot compress, cold compress on and off, aspirin if the client's not allergic, strong massage, and if that doesn't work, then you're going to go in for your dissolve. All right? I just wanted to clarify on, or cover as such, we say to clients not to massage their lips for 2 weeks after treatment. I don't know if anyone does anymore. I know I've had some clients that say, oh, my old practitioner told me to massage every day. I'm really weird about this. I always say to clients, don't massage your lips until 2 weeks after, because during that 2 week time, as a practitioner, you should be massaging it properly before they leave anyway. So I will really hard massage all the filler down so it's nice and soft, and then I'll brush over it to make sure I can't feel any bumps. So when they leave, I know they don't have lumps. So any lumps and bumps that reappear during the healing time is more than likely just bruising and swelling. So if a client continues to constantly massage it, 1, it's risk of infection because they've got holes in their lips. 2, it's going to be really, really painful for them. And 3, if you're really massaging a bruise or a hematoma in the lip, you're just going to make it worse. So I just say to people, don't touch them for 2 weeks. After the 2-week period, if you feel like you've got hard, you know, balls in your lips, then you can start to massage with a hot compress after. However, if you can't do it, just come into the clinic and we can have a look. And then normally, you know, if someone thinks they've seen something, and they can come in and we can have a look and assess ourselves. So yeah, it's a bit grey area. Some people say do it, some people don't. I just say don't, because I don't want them to move the filler around. I don't want, you know, they're not trained to massage. They don't know where they're massaging. You know, sorry, there's a hair in my face. I teach people to massage like this so that they're not squashing the filler out of the border. But if you say to your clients, go home and massage, you know full well they're going to be squashing the border down and just ruining the shape, and then you're going to have to fix it, and yeah, everyone's going to be unhappy. So yeah, just don't touch it, let it settle on its own. Right guys, that is it from me. I really hope this video helped. Please give it a like and comment below what you think. If you've got any questions or you want any help, you're welcome to DM my Instagram page or comment below. Please follow all of my other socials, my Instagram, my TikTok, my Facebook. Everything is at Lindsay Owens Aesthetics for everything. And yeah, like I said, I really hope this video helps, and I will see you all again soon. Thanks, bye.